Hi, this is Dr. Centeno, and let's get into the use of PRP in ligament healing. Now, in the first two videos, I went into the concept of using bone marrow concentrate over PRP for a PICL procedure to treat a craniocervical instability patient. But in this video, I'm going to get into the concept of concentration of PRP. Now, I've talked about this a lot, but this is an important one for you to understand. Because once you get over about 35 years of age, you need high-dose PRP. And that's based on a study we published, as well as others, that I'll show you below here. And what you're seeing there is a graph that looks at older cells, older tenocyte cells, which are very similar to ligament cells, and their exposure to PRP. And you get a direct linear response out of those cells the higher dose you go. So if you're using a little kit and you're getting 4 to 6 times concentration, not only, as I've talked about before, are you exposing the patient to more risk, more contamination risk, if you're doing something like a PICL, but you're also really underplaying your proverbial hand with that ligament, because most patients are going to require a much higher concentration than that, and not only a much higher concentration, but that's going to be directly linked into the repair activity you get out of the ligament. So the higher the concentration, and we're talking here for most of our PICL patients, concentrations as high as 10 to 14 to 15x. If we're going to be using PRP with our bone marrow concentrate, because we don't use just PRP for a PICL procedure. So that's the idea of why we're not using small little crazy kits to make 4 to 6x concentration. We're also not using PRP for other reasons that you can find out in the first two videos of this series. But at the end of the day, this is a critical concept because you have to use the right tool in orthobiologics to get the right result. And if you're underdosing the patient because that's all you got, that's not appropriate in my book. So thanks so much for watching and have a great day.